Hello, everyone. Thank you for joining us for this HoodMed Chat, a special Let's Get Vaccinated on HoodMed Chats crossover episode featuring Dr. Jayne Morgan, who joins us for an update on the latest pandemic developments and to chat about her work managing the pandemic response in Georgia. My name is Dr. Nisi Hudson. I'm the chair and science director of Hood Medicine Initiative.
I'm Jonathan White, co-founder and diversity of policy and engagement.
I'm Doug Slaughter, the Public Health Director.
Hood Medicine Initiative is a collective of scientists, physicians, hackers, and assorted geeks focused on addressing health disparities in Black and Brown communities and reducing the spread of dis and misinformation.
HoodMed Chats, our signature event, is an effort to bring the expertise of healthcare professionals and others to those communities. Our goal is very simple: help us save us. Today, we are excited to welcome our new guest to our first and hopefully many HoodMed Chats, Dr. Jayne Morgan. Thank you for joining us.
Thank you, Jonathan.
Dr. Jayne Morgan is a cardiologist and the clinical director of the COVID task force at the Piedmont Healthcare Corporation in Atlanta, Georgia. She develops ongoing community outreach between Piedmont and the African American community it serves. Additionally, Dr. Morgan will be evaluating the disproportionately negative impact of COVID-19 on minority communities with the goal of optimizing triage, screening, and algorithms for the overall outcomes management of disadvantaged populations positive for COVID-19. Last but certainly not least, Dr. Morgan is an esteemed member and sister of Delta Sigma Theta Sorority Incorporated, which just so happens to be celebrating its 109th Founders Day today. Happy Founders Day, Dr. Morgan.
Thank you. I appreciate it.
Dr. Morgan, could you please just give us an idea of what your role as an executive director of the COVID task force entails? Like, what aspects of the pandemic response are you managing in Georgia?
Yeah, absolutely. And so obviously this pandemic started about 2 years ago. And I like to say, at the time I was just kind of minding my own business, right? I was leading the research program at Piedmont, research and innovation, developing intellectual property for the system, leading an accelerator, working on young startups and inventions within our system, and trying to pair them really with venture capitalists and also developing those inventions. And then we began to track this virus, this coronavirus, right? The ancestral strain coming out of Wuhan. Many people in the hospital system, me included, were redeployed for what was supposed to be a short term, right? We were just going to, people probably can't remember this, but scientists advised we were all going to shelter in place, right? We were going to shelter in place for 60 or 90 days, let the virus pass, and then go just emerge and go on about our business. And, within 2 weeks, we couldn't do it. And people started screaming about one thing or another. And here we are 2 years later, and my temporary position looks as if it's evolving into a full-time position, as other people as well. And so as the executive director of the COVID task force, I'm responsible for understanding the science, translating that science to our external communities that our health system serves, as well as our internal employees, making certain that they have a place to bring questions, that they understand what vaccines are about. What is this COVID? What are the different variants of interest, variants of concern? And so my entire job really has encompassed the dissection of science and then the translation of science into everyday terms such that people can understand the demystification of science. And in that way, I've been addressing vaccine hesitancy and providing education to both our external stakeholders. I go out, I give talks, especially when vaccine mandates rolled in. Lots of companies wanted people like me to come to speak to their employees to get them ready for these corporate vaccine mandates, and then also internally as well. I'd still do a lot of research and publications. I actually have a publication coming out in the Journal of National Medical Association soon, looking at the differences in insurances in Black and white populations. I think during this pandemic, I've probably had 5 or 6 publications, all in the areas of COVID and race, or in cardiology. So I still maintain at my heart, I'm still a researcher. That's what I love. That's what I do. I manage data. And so that's really where I have been. That's kind of what I'm doing. It is a full-time, all-encompassing, fifth served, never-ending, on and on. We're at Omicron. So, do I brace for Nu and Pi and Sigma and Tau? It's just unbelievable,
Yeah.
the situation that we find ourselves in.
It is, Dr. Morgan, and you mentioned hesitancy, and we've been working since the beginning of the pandemic to try to keep our communities informed about the virus and vaccines. But as we've all seen, there really remain some significant challenges in getting the vaccine resistant within the Black community to consider vaccination. Even in Georgia, there's still a gap to close in most counties to get Black and Latinx folks vaccinated. Can you um, speak to that and tell us what you think is at play and what you think it will take to close that gap?
And so historically, when we look at this, we have three aspects in play. And I call this kind of this triumvirate, this triangle, right? We've got research. Black people don't really do research, right? And historically, there are a lot of reasons for that. A lot of historical atrocities have been committed against Black people in the name of the advancement of medicine and science. Well documented again and again and again, and some with government backing. So research just really isn't a topic of conversation. It's not something we feel comfortable with. And then the second part of that triangle brings in what? Big medical systems, where we also have somewhat of a tepid, untrustworthy relationship with these huge medical systems that may or may not be acting in our best interest, where we often don't feel comfortable. And then the third part of that triangle is the United States government. These vaccines came out under government backing in a previous administration that was openly hostile to African Americans. So you bring all three of these pieces of the triangle together and we produce a vaccine. So you can imagine that people, we should not have been surprised. Let's just say that. We should not have been surprised that people stepped back and not stepped up. And then we introduced this new technology called messenger RNA. What is that? And so, from the very beginning, even in the prior administration, I was sitting back and thinking, this is not going to go well. There was no communication nor education coming out ahead of this rollout. We were talking about things like Operation Warp Speed under an administration that people didn't really understand, science that really hasn't worked for the benefit of Blacks. And I could just see this ball was rolling. And yet we still moved forward with it. And we started this entire pandemic, not just in the Black and brown communities, but really throughout the whole world. We started behind the 8 ball. Mm-hmm. And we have been working to catch up since then. And we still, as of today, January 13th, 2022, Dr. Morgan is saying we are still behind the 8 ball. We have never, ever gotten ahead of it. And it's not just in the African-American communities, it's in communities throughout the world. We see large populations of unvaccinated people throughout the world for a number of reasons. If we want to talk about supply, if we want to talk about access, if we want to talk about discrimination, if we want to talk about the privilege of America of just being able to opt out of a communicable disease that affects people around you. So many different reasons. What scientists did not foresee is these vaccines being developed under a previous administration that was not only hostile to African Americans, but also fairly anti-science. Mm-hmm. And so scientists never imagined a world where we might have a contagious pandemic and people actually not listen to scientists. Instead, listen to people with, history majors, accounting majors, no major at all. Somehow they more qualified to speak on scientists than the real scientists. And the voices got drowned out, not because science is not reality based, but because scientists haven't been in a position of having to compete and justify our discipline with people who have absolutely no knowledge of the discipline whatsoever. I mean, it took us a long time to understand, oh my God, this is real. We did not think people would really take it seriously when people with, accounting degrees, stood up to talk about science. Really? That was nonsense to us, but yet people listened. And so here we are, behind this 8 ball in this whole situation that is very politically driven, which is why people follow a specific ideology of people with no scientific background, but providing scientific guidance because it fits in with their ideology. And so we're fighting a number of things, including disinformation campaigns on social media.
Yeah, it's horrible. Talk to us about what the surge is looking like in your region and how that affects management of hospital capacity and other elective services and procedures.
So surge is still on the upswing here in Georgia. We certainly have not reached our peak. I see other areas like New York and Chicago may be leveling off, and they were about a couple of weeks ahead of us. United Kingdom seems to be somewhat on the downslope. We see South Africa, first place where this particular variant was identified. Not the first place probably where it existed, but the
Thank
first
you for that distinction.
identified. And yes, and we already see it dropping off. And so, it may be what we call a variant of exhaustion of the susceptible, meaning it blows in and it blows out. But like a tornado, it leaves a lot of destruction in its path. And it seeks those who are susceptible, those who are vulnerable, those who are not protected, those who do not have on their armor, those who have not prepared, those who are caught unaware, just like a tornado. You haven't been vaccinated. You haven't been boosted. You're not following public health measures. You don't wear a mask. You don't think social distancing is real. Blah, you're at clubs, you're at restaurants, et cetera, et cetera, et cetera. It will find you.
Yep.
The virus does not have feelings. It does not, because our children under the age of 5 have no access to vaccines. It won't say, oh, isn't that sad? I won't infect a child. That's going to be so sad. No, it will absolutely zero in on the path of least resistance. And we see with this virus, it has such a high degree of transmissibility and contagion, like measles. People sadly don't even remember measles. This is measles, and measles was deadly as well. And so we have to think about this exhaustion of the susceptible as we see Omicron blow in and blow out, but it will leave a wide path of destruction in its wake. And what are we going to do about it? Because the fact of the matter, we are behind the 8 ball. And while I sit here right this second on January 13th, 2022, talking about Omicron, this variant that has infected millions of people worldwide now has had millions of opportunity to replicate, mutate, and form another variant. And as we speak, that variant is evolving while we're fighting Omicron. We never have had a strategy to manage the pandemic. We're always managing the here and now.
Yeah. And I think the other thing people don't realize about how little COVID cares about our stupid conventions is that even when you're in Applebee's because it's open and you have your mask on, but you only take it off when you eat, you think COVID cares that you only took your mask off when you got ready to bite your quesadilla?
Right.
You think it cares that the tables are spaced 6 feet apart? Please.
And
It's
the thing
ridiculous.
you have to remember is that even if you go into an empty room, if someone has been there ahead of you with COVID, the aerosols suspend in the air. This is literally air. So you could walk into an empty room and contract COVID because it is suspended in the air. This is a respiratory virus that is spread by respiratory transmission as Homo sapiens on a single planet in the galaxy called Earth. We all require air. We're not able to opt out of air. And so this is a very stealthy virus, very well equipped. If we don't protect ourselves, we can't avoid it because the way that it transmits itself is something that we require for life. For life, that's air.
Yeah, I think
Yeah.
one of the things you said earlier about sort of demystifying the science is really our largest hurdle. I think the majority of conversations I get into in arguments, really, I get into with people who are hesitant or resistant to get vaccinated really involve their ignorance of science. They have no idea how vaccines or viruses work,
Right.
and they tend to think there's some sort of common sense knowledge base that one can have about work that people devote decades of their life doing.
Absolutely.
And it's unfortunate, but unless we get over that hurdle, so people can understand the science in a way that will be meaningful to them, we're going to keep butting our heads against the wall.
Yeah, unfortunately, there are good and bad things about the internet, but the internet has made experts of nobody, and yet everybody thinks they're an expert. So you go on the internet and you get information that may or may not be true. Who knows? Hopefully you get something true, but you might not. And then you get something that's incorrect. And then the algorithm keeps feeding you more of that incorrect information. And then you build your assumption based on that and you continue to grow. And then you're introduced to other people who are also believing that incorrect assumption. And then you all are feeding each other the untruths. And it's just, it's nonsense. Get out of that rabbit hole. You're not a scientist. You don't even understand what you've just read. People read it and then they say, well, this is what I read. Here's what it says. And they read it to me. You don't even know what those words mean. You just read them. And your understanding was, hey, that's not what that means.
Come on, Dr. Morgan.
So
Yeah.
you've got to be very clear that you follow people that are steeped in science. For example, people talk about, I read that this study, it was an observational study, or this observational study, and it shows that people with native immunity are less likely to be hospitalized than if you have the vaccines. And see, I'm telling you, the vaccines are killing people. Really? Show me where it says. And it says, yes, this is an observational study that shows that. And so you think that's true. You know what observational means in science? Observational literally means that it cannot be validated. That's what that word means. It doesn't mean that to you because you don't have a scientific background. So we know when we read that statement, it actually is a disclaimer ahead of the article.
Yes.
Yeah.
But it sounded official to you, so you read it. And now you spread it somewhere else.
Yeah.
That's not what the word observational means in science. And so these are the kinds of things I'm just giving that as just a
perfect example.
Yeah.
There's just a statement. This is an observational study, and people, wow, let's look at it. Because they don't even know what that means. Yeah. Scientists aren't even paying attention to it because that's the disclaimer that's saying, the gold standard of science are randomized clinical trials. So that means that whatever I do here in Georgia, you should be able to reproduce that in India. They should be able to reproduce the same results in Israel. They should be able to reproduce the same results in Brazil. Observational studies aren't that way by design. It just means it's something we are observing, but we haven't standardized it. We don't have groups that we're comparing. We're just saying, hey, this is what we see. It's kind of interesting. It's not worth scientific commentary. And yet the average person who's trying to be informed or trying to be intentionally disruptive takes every piece of information that feeds their narrative and they run with it, and they're reading words that don't have the same meaning in science.
That's kind of, yeah. That's like what we're trying to tease apart now in our research, is looking at how misinformation propagates in the digital space, but like among intersectional BIPOC communities, and focus on that, because our hypothesis is that we're more susceptible to misinformation because we already are going into it with like distrust.
Suspicion. That's right.
Yeah.
That's right. We're already going into it with distrust. We don't, as I said, the triumvirate. We don't trust research. We don't trust the government. We don't trust medical people. And what do we trust? We trust the internet. That,
Yeah.
internet is the biggest source of lies ever.
Yeah.
And so you got to understand what you're looking at. In fact, I created something called the Stairwell Chronicles, and I'll talk about it later. But I did one particular Stairwell Chronicle. I
Oh
literally,
no, we were actually going to bring it up and like and make sure that we drop the link so they can check you
yeah,
out.
I've probably done 90 or 100 of them. I literally sit on the stairs, and in 1 minute or less, I answer a question about either COVID or the vaccine in very conversational terms. I translate the science for you and make it not just conversational, but relatable. Here's what that means. But the point that I'm bringing up with that, and you can see it on social media, the point that I'm bringing up is I did an entire Stairwell Chronicle on stop doing your own research. People were advising, hey, if you don't believe it, do your own research. I did a whole Stairwell Chronicle that said, time out, stop doing your own research. Not a good idea. You need to follow people who are steeped in science, who can give you information, who don't have a platform or nor an agenda, unlike we see some of these physicians in politics who are shameful with what they are doing in under the auspices of a medical degree. Don't follow somebody in politics. Follow somebody who has no political agenda, who's just here for the science. And find a person. I am one of those people, but there are also other people. And I do it in a communicative forum called Stairwell Chronicles. And in one of those, I ask people to please stop doing your own research.
One of the things I think that we benefited from in this situation, well, some of us have, is, I think I've realized that not all doctors are the same. And, it's tough to say this because you hope that every physician or person in the medical field or person in the science field has the same goal of making sure we create a healthy and safe environment for human beings. But somebody who, is a brain doctor isn't going to understand virology the same as somebody who deals in infectious disease, and so if somebody's coming to me and he's a general practitioner or a family medical doctor, and he's giving me advice about, taking vaccines, but he hasn't read the primary source information about the vaccines and doesn't really understand the science behind the specific vaccine, I shouldn't take his advice as much as I should take somebody who's actually worked in the labs doing the work on RNA vaccines and understands the science behind it.
Yes and no. All doctors have the capacity to understand all aspects of medicine and science. It's constantly evolving. That is a part of our discipline. If you want to be in something that's static and stays the same, do not get into science. Do not get into medicine, because what you learn as you're graduating from medical school may not even be the way you're practicing 10 years later. That's just how quickly the information moves. And so I will say, I take myself as an example. I am a cardiologist, but I have the capacity to understand. Now, my background also is in research. I spent many years in really hardcore R&D in industry, developing drugs, going before the FDA. So I have a really deep understanding of what it means to develop vaccines and develop drugs. But doctors also have the capacity to understand that if they sit down and read it. I'm formally trained as a cardiologist. I came in through R&D, so I have a really unique background and able to bridge those things to bring you that information. But it's not just your infectious diseases experts. It is all physicians who are managing patients. Your pediatricians must have a deep understanding of it such that they can manage patients and advise their families. Yeah. Your primary care doctors must have a deep understanding because they are the gatekeepers of everybody that's going to the specialist. Almost nobody actually sees an infectious disease specialist. Almost nobody has ever been referred to an infectious disease specialist, certainly outside of a hospital setting. Yeah. So we depend on all of my colleagues to understand these vaccines and to understand the science, utilizing their foundation of medical knowledge and the information highway to make certain that we can be good stewards of information wherever we are. So I hear what you're saying, and I would just say yes and no, but your primary care doctor is probably more informed than any other specialist other than the infectious diseases person, because that person is the gatekeeper and is seeing everybody. The neurosurgeon is only seeing, a really small slice of people who need neurosurgery. And so we've got to be able to think about that. But, unfortunately, as I have learned, it's sad for me, but all doctors are not good doctors. All doctors do not
Facts.
really adhere to their Hippocratic
Story
oath,
of my life.
and have been I have seen doctors swayed by different personal platforms for whatever reason. I don't even know what it's about. But I would say they are in the minority. Unfortunately, they are very vocal and get a lot of attention, but it's still not that many of them. But unfortunately, just a few have been able to do a lot of damage, and we are working to undo that damage.
We have a question, audience comment actually from the chat. Speaking of your colleagues, and this one is from Beck Smith. And they say, I'm in healthcare. Every morning, my question is the same. How long can I keep doing this? We're seeing a lot of healthcare workers are exhausted and worn down from putting their lives on the line while we all party. People are leaving the profession. There's been a huge rise in depression and suicide rates among doctors and nurses. And now with this new variant, we're seeing staff shortages due to COVID infections. So can you just talk to us about what effect this is having on the system's overall capacity?
So when we look at really all of the surges, well, let's just talk about the Omicron and the Delta and the Omicron, the last two that really are big surges, really stressed our healthcare systems. The first one, the ancestral strain, the first strain coming out of Wuhan, we really didn't know what we were managing, also very much stressed our healthcare systems. But what we see in this Omicron is the direct impact on the people who are trained to save you if you come to the hospital. Now we've gotten to a point that we have created a variant that is knocking out the very people who can save you if you come to the hospital. Oftentimes, most physicians and nurses in hospital systems, certainly those hospital systems that have mandates, are mostly vaccinated and fully vaccinated. And so, thankfully, they generally are not that ill and they are not hospitalized. But because they are positive, they have to leave work. The other thing about this particular surge is we see our vaccines under challenge. We see breakthrough infections, even those who are fully vaccinated, at about 10%, much higher than we saw with Delta or with the Beta variant. We also see the unvaccinated coming in higher numbers because of the volume of people who are being infected. And so what that means is that's that many more touch points of contact and possible transmission to healthcare workers, again, who are there to save you. Even if your behavior is irresponsible, even if your behavior is callous, even if your behavior has been negligent, even if your behavior has been hostile, even if your behavior has been hateful, for whatever reason, your behavior and your choices have brought you to the hospital sick enough to be admitted with COVID, we still care for you. And if we are not there, who is going to mitigate your errors? And are you willing to pay that price? And the other aspect that we have, not only the vaccines, we see our other medical therapeutics under challenge. We used to have 3 different monoclonal antibody therapies that we could infuse you with if you met the criteria. Omicron has rendered 2 of them ineffective. So that leaves us with just 1, and there's not enough supply. That puts physicians in the position of triaging care. who will get it and who will not. And if you think that is easy, that is demoralizing to doctors who are trained to give their best to everyone. The emotional and mental anguish and toll of the decisions that you make, the haves and the have nots, is demoralizing. And we are seeing the decay of our health system that truly is in crisis based on our behavioral choices that have continued to drive this pandemic. It is only alive and well because we have chosen to allow it to continue to be alive and well. I don't know what variant will have to be created for us to really get the message.
Yeah, we say that all the time. I don't know where the numbers would have to rise to, the death toll, before people would take it seriously. It's
Mm-hmm.
unfortunate.
You know, we've talked a lot about the science behind the variants, and how they change the landscape of the pandemic in terms of community spread, right? Herd immunity, vaccine effectiveness. But what about like a clinical perspective on symptoms? What do folks need to know about symptoms particular to Omicron versus Delta or
Mm-hmm.
the ancestral strain? And should they be tested when they're symptomatic, even if they
Mm-hmm.
think they're just experiencing seasonal allergies?
Mm-hmm. Mm-hmm. So let me just start with what the symptoms are. So with
Mm,
Omicron, your symptoms can be things somewhat different from Delta that are more like headaches, body aches. Early on, we were seeing high fever. We don't necessarily see fever that much anymore. Loss of taste or smell, which we saw a lot with Delta. We don't really see it with this one anymore. And so it's this overall sensation of fatigue, being very tired, um, headaches, and muscle aches, and the overall general sense of unwellness, stuffy head, cold, and flu symptoms. If you have any symptoms at this point in this Omicron surge, if you have any symptoms that are similar to a cold, a flu, or an allergy, you should assume that you have COVID and isolate unless you can get a test that proves that you don't. It's actually the opposite of the way it used to be. Assume that you have it. Don't assume that you don't have it, and immediately protect yourself and protect others. Unfortunately, we don't have enough supply of our at-home tests. We don't have enough supply of our antiviral pills, Paxlovid and Molnupiravir, that are available from Pfizer and Merck. They don't have them. I mean, imagine that. Imagine that we are in a surge with a variant that some people are not taking seriously, that is challenging our vaccines, that has rendered some monoclonal antibody therapies useless, that is knocking out our healthcare workers, and we still aren't taking it seriously. I'm not sure what it's going to take.
Jonathan, I think you're muted. Did you mute yourself?
Oh yeah, I'm sorry. Thank you. I was saying earlier, there's some concern that there may be a variant developing that is a mixture of both Delta and Omicron.
Mhm,
The deadliness of Delta with the contagiousness of Omicron, and
mhm.
that's really a scenario we don't want to reach.
Yeah,
Because the way Omicron has infected everybody and their mama and their daddy and their cousin and their uncle. Um, if Omicron was as bad as Delta was, I can't even imagine what our community would look
right.
like right now. It'd be devastating.
So this
You know,
Delta cron that people talk about, so vaccines don't work by mixing with one another and creating a new strain. So it's sort of not like, anything else that we breed, but they can take properties from one variant as they emerge and develop into another variant. One thing about Omicron, and I really reject this narrative of don't worry about Omicron, it's not a severe disease. In fact, let's just try to get it and get it over with so we can have some immunity. This is, crazy
right.
talk. That's just nonsense. And one of the things you should think about with this virus, the characteristics of this virus, which is why it makes it a formidable foe. Think about what it has done in Omicron. It is causing less severe disease, but much more highly transmissible, infecting everybody, including children. That is evolutionarily advantageous.
Come on.
It doesn't actually want to kill its host, us,
No.
because if it kills people, it also dies. Think about it. So it has evolved such that it can infect as many people and develop as many opportunities to replicate and mutate, but not kill off the very host that needs to go back and reinfect again, right? Omicron is reinfecting Delta, reinfecting those with Delta.
Yeah,
That's right.
So it lives to create havoc on another day. And that's why I say most assuredly another variant is coming. And what you're asking is, can we have a variant that turns out to be the variant, the lethal one, where none of our drugs work, none of our vaccines work, and, you know, apocalyptic end of the world situation? So I'm going to say, I hope not. I hope that at some point we continue to come up towards herd immunity. I hope that even with Omicron infections, there will be a higher level of exposure and in our communities, even if it's not to the vaccine, it's been to the virus. And I'll talk about that in a minute, why that's still not a good idea. And I also hope that we can get vaccines out to other third world countries, because we are a global society. You can see that if South Africa sneezes, the people in the United States are going to feel it. We cannot.
Come on. We are connected, you guys.
So and you see what's happening in the United Kingdom. We see what's happening in China. This is, you know, Earth is so little. It's just Earth. Like, this is all we have. This is just Earth. And we choose to divide ourselves up into all these little things, which is probably, you know, funny to anything outside of Earth. We are all this is our only planet. We are all Homo sapiens. We all require air. We all will be infected the same with this virus. And we cannot think about it in our communities. We've got to think about how we're going to defeat it around the world, or it will continue to raise its head. You cannot defeat it in the US, but not defeat it in Brazil. You cannot defeat it in Japan, but not defeat it in France. I mean, it's just not going to work. Yeah. That's not how the world is, especially, again, we're not talking about water. We're talking about air. It's very hard to contain free air.
Come on. Close your mouth. Cover your mouth. Cover your nose. Stop it.
Especially
to your point, like, you know, about how interconnected we are, how quickly we see with Omicron, a new variant could circle the globe 2 or 3 times. We've heard from WHO and the EMA, which is the European, like, FDA, this week, cautioning all of us against relying on vaccination strategies that are too heavily focused on repeated boosters without prioritizing efforts nations and expediting, like, the next generation of vaccines. Is it time for updated vaccines to cover this new wave of variants?
And that's exactly what I'm talking about, is a strategy. We need a strategy for how we're going to defeat this. And that sounds very close to a strategy. Let's address the unvaccinated and see if we can get rid of these reservoirs of variants emerging. The variants are coming from the unvaccinated. And so we have got to address that. But then we have the other side of it, where we've got people who are vaccinated and protected. And if we don't continue to give them boosters against the variants that are developing in the unvaccinated, then they will also succumb to the behavior of the unvaccinated, even though their behavioral choices have been different. There will be a variant that will come out and overcome the vaccines. And so the vaccinated may be committed to more boosters, but at the same time, we've got to address the unvaccinated, or we'll never get off this merry-go-round.
It's interesting. This is sort of on the side. I think there's this unscientific um, belief in several communities that folks who are vaccinated are the problem because the virus wants to infect as many people as possible. And because people are vaccinated, the virus can't get us. So it's changing itself so it can alter itself and still get us. That's not really how viruses work. They don't have this method for, okay, let me mutate in this way so I can infect these people. It just so happens that the mutations that last are the ones, as you said about Omicron, the ones that infect the majority of people. But these mutations are happening randomly in our bodies.
So that's a great example of this convoluted thinking that they twist themselves up into a pretzel until they come up with some illogical conclusion. So people have forgotten why it is that we don't even have polio. Maybe you never knew.
Talk on it.
I don't know. But you've forgotten why we don't have polio anywhere in the world. And that is because of vaccines, not the rampant spread of the polio virus that killed and maimed and was the most feared disease at one point all over the world. And then smallpox. You don't remember it because vaccines have given you the luxury of being indifferent.
Mm-hmm.
Yeah.
So that thinking is convoluted thinking where you twist yourself up and you come out with a conclusion that is incorrect, but fits your narrative. And I even had trouble following Jonathan through all the twists and turns of illogical considerations with that. That's actually not how viruses work.
Yep. Yep.
And if you think that that's not true, then ask yourself why you don't know anybody who has polio.
Or measles is only back in the news because there are communities who decided to remain unvaccinated.
Mm-hmm.
We never had any issues with measles, growing up because most people were vaccinated. Now you got these communities who want to be anti-vaxxers. They're not vaccinating their children against measles. And now we have measles popping up in these small communities and infecting the entire populations.
Mm-hmm. Yeah. Yeah, absolutely. And people who are anti-vax, the reason that they stay healthy, you may look at them and say, well, they never get a vaccine. They seem healthy. They enjoy all the liberties I enjoy. Maybe I shouldn't get a vaccine. Look at them. Well, here's the reason that they stay healthy. As long as the unvaccinated remain a small slice of our population, they benefit from herd immunity. They live within the herd of America that is vaccinated. And so there are no portals via which disease can enter because they are surrounded by people with armor. And so when they say, you know what, I don't take vaccines. I've just reached a higher level of nirvana. I take a really specific cocktail of vitamins every day. I exercise and I have a specific physical peakness that I have achieved that is superior to yours. Here's why you don't get sick. You don't get sick in inserting your independence and refusing vaccines because I got my vaccine. So your independence that you're asserting actually makes you dependent on me.
The rest of us.
Come on,
Talk
Dr.
about it.
Morgan.
Me.
All right, Dr. Morgan.
How is my health? Because your health is dependent on how healthy I am. You
You're
need to
welcome.
inquire more about me.
You're welcome.
Yep.
Honestly, we talk about that a lot because, I think people just kind of have this notion that the vaccine is just this like force field that protects you. And we keep reiterating to people that this kind of airborne pandemic is also a disease of personal responsibility. And so we have to create physical barriers to infection. We don't tell people to, take vitamin supplements and have a good diet to avoid HIV infection. We tell them to use condoms as a barrier. We don't tell people with chicken pox to like have an apple. We tell them to isolate from other people so they physically cannot communicate chicken pox to someone else. So you always in the back of your mind have to be thinking these are air particles. They will float right into your mouth from the Applebee's. And along with vaccines and other, community protections like testing and guidelines that we all should follow, you also have to take personal responsibility for erecting physical barriers to viral particles entering your body. I just wanted to make that pitch really quick.
I've tried to explain to people, it's like every time you walk into a closed place, you're walking through a spray of bullets. And maybe you don't get hit by a bullet, but that's not because you did anything special. You're just lucky. That's all it is. I worked in, the supermarkets. I did deliveries during the early part of the pandemic for neighbors who weren't willing or able to go out of their houses. And I never got sick. It wasn't because I did anything special. It was because I was lucky. Any day I could have gotten sick from it, but I didn't because I was lucky. Now, if you didn't get sick and you haven't gotten the vaccine, it's not because you took some zinc and some orange juice and mixed it together. It's because you just got lucky, and your luck may run out one day.
Mm-hmm.
Thank you so much, Dr. Morgan, again,
You're
for
welcome.
giving us your very precious time today. In honor of your Stairwell Chronicles, is there any advice you'd like to leave us with about the tough choices we need to make?
Yeah, absolutely. Follow somebody steeped in science. I'm going to suggest me because you've just been exposed to me, but find someone similar to me. I do these Stairwell Chronicles, but I also post other information. You can follow me on Instagram at Dr. Jayne Morgan, DrJayneMorgan. It's just the facts. It's just the data. It's not my interpretation. It's not my, bent on it. And then I also do Stairwell Chronicles. Feel free. I've done 90 or 100 of them. Scroll through. Pick something that speaks to you and listen to it for 1 minute. If you don't like it, right, it's just been 60 seconds of your time. It's no big deal. Not only on Instagram, I'm on Twitter. Same thing at Dr. Jayne Morgan, Jayne. I also have a YouTube channel where a plethora of things are posted, including all of my interviews on CNN, all of my interviews and the webinars, all kinds of things. So it's even broader than just the Stairwell Chronicles. Sit down, take the time to get information from someone without an agenda, but with the education, experience, clinical discipline, and background to actually provide real science information to you that you can then make a decision based on information, not based on someone trying to sway you in one way or another. So feel free to follow me on any of those platforms. I'm also on LinkedIn, Jayne Morgan, MD. I'm happy to include you there. So I appreciate being invited tonight. This was lovely. I hope it was helpful. And I'll say good evening to everybody.
Thank you
Thank you
so
so
much.
much. Yeah, we really appreciate having you. Thank you, Dr. Morgan, again for joining us today, and thank you for tuning in to this important Hood Med discussion. At Hood Medicine, we bring you real talk and mad science. You can find us at hoodmedicine.org. Follow us on social media and subscribe to our YouTube channel. You can support our org through buying gear from our Bonfire store or making us your Amazon Smile charity to support our work. Thank you again. Stay safe. Please vaccinate and get boosted and erect those physical barriers. Protect yourself, protect your family, protect your hood. Thank you.
Thank you, guys. Have a great day.
Bye. Thank you.